Hi, my name is Dr. Louisa Kimeli. I'm a psychologist and director of the Emotional Health CBT Clinic in Montreal. Every fall, we have a series of lectures that we usually give in person, but this year we are starting to give them in a video format. And these talks are in honor of the founder of the clinic, Dr. Michael Spivak. And this week, the lecture is on OCD. And also because we figured that in a video format, an hour can be kind of long. So I've decided to break it into two pieces. So the first part, which is this one, will be about what is OCD, and the next one is going to be about the treatment. So what is OCD and what to do about it? So before 2013, OCD was considered to be an anxiety disorder. But then in the new DSM, which is the book that is used to give diagnoses, at least in America, it now has its own chapter, so its own category, which is called obsessive compulsive and related disorders, based on the fact that they found that these problems have a lot in common. So related disorders are things like body dysmorphic disorder, hoarding, hair pulling, skin picking, as well as other. So OCD has its own diagnosis. And what it is, so it's really obsessions, compulsions, or both. Most often both, but it could also be just one or the other. So what is an obsession? It's thoughts that are, it could be thoughts, it could be images that are intrusive, they're unwanted, they elicit distress, they're recurrent, persistent, and the person, doesn't want to have them. So there's attempts to suppress, to ignore, to neutralize, to just like make it go away however one can. And actually one way of doing it sometimes is compulsions. And compulsions is a repetitive behavior. It can be overt or covert, and what we mean by that is overt is what you can observe. So someone with a fear of contamination will excessively wash their hands, and that's something that you can easily see and measure. A covert behavior might be, for instance, someone has a thought about something happening to a loved one, and the way that they try to undo that or make it okay is by counting. So you don't actually see it, but it is happening. It can be in response to an obsession or not. It can be a compulsion, like symmetry, like things like there's rules that need to be applied in a very rigid way. And the aim is, to prevent, reduce the amount of distress and discomfort that the person is in. And compulsions are either not connected in a realistic way to what they're meant to control. So, for instance, counting or touching an object is not going to prevent a loved one from being in a car accident. But they can be, part of the obsession and compulsion. Or it's clearly excessive. So, yes, washing your hands can to some extent prevent disease, but up to a point. And so in OCD, the behavior is like clearly excessive relative to what we would consider to be normal. They are time consuming or cause distress or impairment in function. Oftentimes people will have a hard time leaving their home because they're not finished doing what they feel they need to do, or just a lot of distress or irritability with loved ones if they're in the middle of doing something, and so it does cause impairment in function. It's also, interferes with people's ability to think. Like if you're always having these kinds of thought, you can imagine that if you're trying to do some work, it's going to be difficult to do. So distress or impairment in function. Some common obsessions, they're typically thoughts that people don't want. And so it will vary from individual to individual. So if you, let's say that you're not religious, you're not going to have thoughts about, the devil or things that, you feel like you shouldn't have, because it's a bad thing if you have the thought. So they're typically sort of the thing that the person would want the least, so like a new mother will have obsessions about hurting her baby, for instance, or someone will have obsessions about, what if I'm a pedophile? I might be a pedophile, and what if I act on that? What if I hit someone with my car and I don't know that I did? I might have hurt someone, I might have killed someone. And again, it's, it elicits this anxiety and this distress because it's so much against the person's values, what's important to them, and the kind of person they are, so and that's why they don't want to have the thoughts. So they tend to be aggressive in nature or sexual, but sexually inappropriate, let's say. Contamination thoughts, about hurting oneself, hurting others by contaminating them. Religious thoughts, if the person, if the person is religious. Thoughts related to harm, danger, embarrassment. Might be about, I could push someone in front of the metro, those kinds of things. Superstitious or magical, perfectionistic in nature, like in terms of how things, need to be, or just neutral. So it could be that, someone has a phrase in their head that they just can't get rid of it. They don't want to have it. They try to make it go away and it keeps coming back. So that would be like an obsession as well. What are some common compulsions? There's, decontamination. So hand washing, showering, taking off, one's clothes as soon as you get home, like not wanting to, or not allowing anyone in the home to sit on the sofa with their clothes that they came home with, this kind of thing. Checking that the stove is off, checking, it's always related to the fear, really, but those are, again, examples. Magical undoing, so, touch wood kind of thing. Perfectionistic, so about, moving things so that they're straight on the desk and things are symmetrical and in their place. Counting, so counting to undo, counting as a way to decrease the distress. Touching or movement. Mental, it can be like really anything, can be a compulsion that is being done to try to reduce the obsession, or just that you feel like you can't stop doing. Like it can be just a compulsion per se. So common themes, cleaning, symmetry, forbidden or taboo thoughts, harm, and the common emotions really are anxiety. It can be disgust as well, guilt. Those are, most common emotions in OCD. Now the facts, at one point in time, about 1.1 to 1.8 of the population would meet like diagnostic criteria for OCD. Over the lifetime, so 2.3% of the population will have OCD. In childhood, it tends to be slightly more men, and in adulthood, slightly more women. The mean age of onset is around 20 years old, and without treatment, though, it does tend to persist. So when they look at people 40 years later, 80% of those who had OCD symptoms still have later on. And as is the case with other disorders, like there's often what we call comorbidity, which is that if you have one disorder, you're likely to have another. And 76% people with OCD also experience anxiety, 42% experience major depression, and 30% a tic disorder. So those are sort of the most common disorders that will come with OCD, which makes sense. There's a lot of anxiety from the OCD as well as from the consequences. If you're late and you can't perform and it is causing conflict in relationships, and it's bound to also bring some anxiety and lead to depression as well. Like it can be very limiting when people spend hours doing some ritual that they feel they need to do. And in children, they found you can find a triad of OCD, ADHD, and tic that will come together. In terms of the risk factors, so there is definitely a genetic component. People, especially when OCD is found in childhood, so in childhood or early adolescence, like if people have OCD, then other members of the family are 10 times more likely to develop OCD. When it's later in life, it's a little bit less likely. But anyway, bottom line is that there is a genetic component, and they do find some areas of brain function that are a little bit different in OCD. There's also temperament and the environment. I think this is, the case for all psychological disorders. There's always, a little genetic biology, environment, temperament. So it's an interplay of different factors. Now, the CBT perspective is that OCD is really about avoidance. So it's avoidance of uncertainty, like feeling very uncomfortable with not knowing with 100% certainty that their loved ones are okay, that they're not spreading around this disease, that they're not causing a fire at home, that, so it's having difficulty living with that risk and trying really hard to increase the level of certainty. It's an avoidance of negative emotion. There's also some thinking errors that are involved, as well as going into fantasy a little bit, in the sense that oftentimes OCD thoughts have nothing to do with the moment. There's really no evidence for the thoughts, but they just lead someone to make up a story in some sense that is believable, but it still is not based in the here and now. In terms of thinking errors, I will talk about this a little bit more in the treatment part of the lecture, but we're talking about the overimportance of thoughts. So what having a thought means, thinking that we can control thoughts, overestimating the danger, the likelihood that if you were to leave the stove on all day and leave your home, that the house would catch fire. There's a sense of responsibility that's also that tends to be not quite normal, like taking too much responsibility for events. Perfectionism, and also thinking errors about the consequences of anxiety. So these are all targets really for change, things that we can work on. Now, in the context of COVID, OCD does come to mind, because all of us are hand washing, certainly a lot more than we otherwise would. So the question can be asked both ways, like, will this pandemic lead to an increase in the rate of OCD, and how do people with OCD cope? And I think the first question, will it increase the rate of OCD? From what I have read, most experts would say probably not. I mean, there's, like I was mentioning before, an interplay of different factors, including genetics, temperament. There's a biological factors. And experience, past experience. It's unlikely that if you didn't have OCD before, that you now will develop, full-blown OCD disorder. Now, any stress does increase the risk of mental illness, and then that will depend on your predisposition in terms of how that goes. I would think that, for most people, you already see it, like people being more stressed means people are eating a little bit more, they're gaining some weight, some people are sleeping, some people are not. They can become night, like there's all these little effects based on what the person's natural tendencies might be, in terms of how they cope with increased stress. But it's unlikely, like OCD is quite a specific disorder, and it's unlikely that you would develop OCD from what we're living right now. This is my own observation here in Montreal. I don't know, I strongly suspect that it applies elsewhere. Also, we just saw when we were deconfining in the summer, I mean, people were just hanging around in big groups, and it was, sometimes as if there was no pandemic. So I think people will be pretty quick and will go back with ease to how things were before, once that is an okay step to take. And for the people who have OCD and are now faced with the pandemic, it can affect them in different ways. One way that is more positive is that, at this moment, I've had clients that, really said they're not feeling as alone or odd anymore. It's like they're, like everyone else is, if anything, more anxious than them, because like they're used to dealing with this, and the people in their family or other people are not. And something that is most of the time true with anxiety is people imagine these terrible things happening and how they would not be able to cope, and that's the anxiety. Most of the time, when an anxious person is faced with a real problem, they actually do well. So, because there is a solution. Like when you're dealing with fantasy, with what if thinking, you can't quite resolve it, right? It's like trying to make a puzzle without having all the pieces. But when you have a real problem, then you have all the pieces, and anxious people, or people with OCD in this case, are probably good at coping with something that is real. Now, of course, there are more triggers for the OCD, especially for people who had OCD around contamination. So you cannot go with feeling, because you're never going to feel like it's good enough. And that's, I think the distinction between someone without OCD and with OCD is that without the OCD, you read that you need to wash your hands for like 20 seconds and rub like this, and you do it and that's it, you're done. Like you've done exactly what they told you to do, and you don't give it a second thought. Where someone with contamination, with a fear of contamination, OCD, is just, it's never enough. Like you never know that you've taken off all of the virus, should it have been on your hands. And so the trick here for people with OCD is really to just like to be able to follow the guidelines. But that feeling that they get can be a trigger, as well as news, thinking errors, right? Because there's always a possibility. And also, this made me smile, but there's people with OCD that have said, they should be hired for like looking at the errors that people make in terms of sanitation, because they do spot, all of the things that we do that don't make sense, and there's plenty of them, in terms of, you wash your hands, like you'll take off the alarm at home before you go wash your hands, but then you never wash that, but then you'll put it on at night. Like they can very quickly see the things that don't make sense, and so that can be a bit of another trigger, and there you have to realize that rigid rules are not really helpful. And what you see also is that people with OCD who are in treatment do better. Like it's a good thing to be in treatment at this point. And as you will see in the treatment part, in a way, this pandemic is also an opportunity to practice the skills that one with OCD needs to develop. It's actually quite ideal for that. So this is it for the what is OCD, and I hope that you join us for the even better part that is about treatment. Thank you.